So why, if you're only missing one tooth, why get a dental implant over a traditional bridge?
Well, first of all, with getting a bridge, you have to harm the teeth on either side of that space, and that's irreversible. You're grinding these things down to pegs. Got to put them on top. They're attached. They're hard to clean because you have to go underneath these bridges now. They've only been shown, studies show they only last 8 to 12 years.
Okay.
And then at that point, the seal breaks, bacteria and decay get in under there, and we can't see through these bridges on x-ray. So it's usually not a problem until it's way too late. We get that bridge off, and now you've lost one or perhaps both of those teeth over that 8 to 10, 12-year period. It's pretty damaging.
But it's all you had to do.
It's been working great. I mean, in fact, when I started off, it was the only choice out there. So, I mean, there were those partials, but not for just one tooth. That wouldn't apply.
Okay.
But for bridge work, yeah, it was something else. It worked great. And it was fine. However, there's something better. By going inside, in between the teeth, having a self-supported tooth, getting in there, having an implant, you're able to floss now like natural.
So a single tooth, you just put it back?
You just put it right back, and then it's great because it just stays there. It's like very close. It's the closest we've come, Randy, to replacing natural teeth. I mean, it has its own root.
What about expense? Like implant versus a bridge?
Short term, an implant could be a little bit more. However, long term, hands down, the implant will pay off because just to replace the bridge, there's already double that fee, whereas an implant has been known to last 20, 30 years once it's
So
integrated.
if you take care of it, it should last as long as you last.
I have a hard time saying forever with anything. I mean, I do, but I can tell you it's as close as we've gotten to that.
If somebody in your family was an adult, lost just one tooth,
Right.
would you always go an implant over a bridge?
Absolutely, I would. Always. See, always is an interesting one. I don't like to always say always. I mean, there are cases where, say, if they're already capped, they've already been
What if it was just
out.
a front tooth got knocked out?
Oh gosh, yeah, that's
always an implant.
Always an implant. Always an implant.
Or a rear tooth.
Rear tooth.
Whatever you guys call them.
Tooth. Yeah, even a back tooth. I'd put an implant there. Absolutely, absolutely. As long as there's enough room. I mean, there's three things, Randy. We just look for a healthy body, a healthy mouth, and enough room. And if you pass all those tests, we're good to go.